Hello everyone, my name is Ilse Gonzalez and today I'm going to be talking about leukoplakia. Leukoplakia is very important if you are a heavy smoker or if you know someone that is a heavy smoker. Leukoplakia is a condition in which there's white patches all over inside of your mouth. There's white patches on your vocal folds, the back of your throat, on your cheeks, on your gums, and on your tongue. There can also be white patches near your lips or on your lips. This condition can range from mild or severe cases. Mild cases, usually the patches may go away in a few months, and in severe cases, these patches are a sign of vocal fold cancer or oral cancer. By the way, these patches don't hurt, but if they do start to hurt, then that can lead to having like cancer or it can be another condition. Now, what is the cause of leukoplakia? So there's not an exact cause, but it has been primarily linked to tobacco. So if you smoke and chew tobacco, that can be one of the main causes. And then there's also other cases in which it was caused by an injury on a cheek or uneven teeth or long-term alcohol use. So some symptoms of leukoplakia is, like I mentioned, white patches all over your mouth. There can also be red patches on your mouth, and then also having a raspy or hissing voice, rough voice quality, vocal strain, or vocal fatigue. Now, there can also be some hairy like white spots in which it look like hairs are growing out. And then if these lesions or patches begin to grow, it may be difficult for you to swallow. So when should you go see a doctor? You should go see a doctor as soon as you see white patches all over, or if they become painful, or if it's difficult for you to eat or swallow. Diagnosis. So usually doctors do an oral mechanism exam and they'll see if it is leukoplakia or if it's something else. Like it might be confused with like canker sores if you have like a lot of white canker sores, but those typically go away in like a week. But if these white patches stay for more than a week, then doctors may know or will say that it is leukoplakia. However, if some white patches look different or odd out of the ordinary, doctors will be able to perform a biopsy to rule out oral cancer. Now, for prevalence, leukoplakia is relatively rare. It affects less than 5% of people worldwide, and studies have shown that less than 15% of people with leukoplakia develop oral cancer. We have two different types of leukoplakia. We have the homogeneous leukoplakia, in which it's like the flat white patches all over, and that is the most common, and it doesn't necessarily lead to oral cancer. Next, we have the non-homogeneous leukoplakia, in which this is less common, and there's like irregular white patches all over, and then there's also red patches. This has shown that this is 7 times more likely to become cancerous than the other type. Now, we also have subtypes in which it's PVL, and these are the white patches all over your mouth and they spread to your gums, to your tongues, and in between your lips. Studies have also suggested that more than 60% of people with PVL develop oral cancer. Another subtype is the oral hairy leukoplakia, in which I mentioned that there's white hairy patches all over your tongue, and these spots are most likely look like if there's hair growing out. And this type does not become cancer. Now, for treatment, some patches do get better and they don't need treatment. However, if a biopsy comes and it says that a patient has oral cancer, these patches can be removed, and they are removed typically by a scalpel or a laser. There's also light activated cancer drugs or cryotherapy, in which they just freeze off the white patches. Prevention. It is very, very important to stop smoking or chewing on tobacco because these are the main causes that cause these white patches all over your mouth. Also, reduce alcohol take. And it is very important to eat fruits and vegetables because they help reduce the patches and have good oral hygiene. Now, for long term, it is not a very life threatening condition, but it does have history of increasing your risks for oral cancer. And studies suggest that leukoplakia comes back around 15% of the time after it has been removed. So, if you know someone that is a heavy smoker or you are a heavy smoker, make sure if you ever develop white spots to immediately go to the doctor and stop smoking. Thank you.